Sean Duffy is co-founder and CEO of Omada Health, a virtual first care provider for pre-diabetes, obesity, diabetes, hypertension, and musculoskeletal disorders.
A mouthful, yeah.
That's a lot. With nearly 2 decades of healthcare experience, Sean is widely recognized as a thought leader in the industry's future. He has written extensively about digital health and the healthcare trends in the New England Journal of Medicine, the Wall Street Journal, Forbes, and TechCrunch, among other publications. Sean has also spoken at notable conferences such as the World Economic Forum Annual Conference, Clinton Global Initiative Healthcare Matters Summit, the Society for Behavioral Medicine, JP Morgan Health Conference, and others. Under Sean's leadership, Omada has been recognized as one of Fast Company's 50 most innovative companies in the world and a technology pioneer by the World Economic Forum. Prior to Omada, Sean worked at both Google and IDEO, a former MD, MBA candidate at Harvard, and he holds a BS in neuroscience from Columbia University. Wow. Very cool. Thank you so much, Sean. I'm very excited to have you here and very excited to learn more about your journey. And again, thanks for sharing your time with us.
Yep.
Okay, so let's start it off with for those who haven't heard about Omada, could you explain who are its customers and what problem it is that you're helping them solve?
Yeah, perfect. Well, firstly, thank you for having me on. Hey, everybody. And then, as I share remarks, definitely, jot down things I say that pique your attention, and I think we've got some Q&A time at the end. So, in that, feel free to ask literally anything and everything. So, I'm Sean, co-founder and CEO of Omada. Omada, per the tee-up, we're a virtual care company. So, for those not in healthcare, think of us just like any other provider. I mean, we contract as a provider, we file claims just like any other provider. Yet we don't have any offices, and we focus explicitly on clinical areas where I recognized at the early days that digital could not just be incrementally better, but transformationally better. So, out there on behalf of, Omada, I call us a between visit provider. Because for things like diabetes, it's so clear that saying to a patient, hey, look, I'll see you in 6 months. Between then and now, take your meds, lose weight, test your sugars. It doesn't work. So you have to have a lot of proactivity, be there for someone on a day-to-day basis. And so our job and task and contribution is really to find a path to really do that at scale and change the way that these types of conditions where an in-person visit model doesn't work, can be handled for the country.
Where did the idea of this come from? Because I know, so you worked at Google and all that, but like where did this derive?
So I studied neuroscience in undergrad at Columbia. I had done my pre-med recs, but it was I graduated in 2006. And for those of you who can kind of bring your brains back to then, like Silicon Valley was amazing back. That's always interesting. But it was like, that was right when interactive web apps were like a thing, and you didn't have to click on the corners of MapQuest, and like Google was just like flying.
Right.
Like, so at night I'd be reading, Slashdot, like yesterday's Hacker News, but not cracking open my biochem book. So I actually I just like panicked about going straight to medical school. So worked at Google, realized that the worlds weren't so black and white. Decided I want to do something tech meets healthcare, went to medical school. Harvard has an MD MBA program. Was in it. They asked, I thought I'd build like the Starbucks for primary care. That was kind of my vision back then, but I was in it. They asked that you take an internship along the way that blends business and medicine. And I had known some folks at IDEO, design firm headquartered in Palo Alto. And so came out there, thought I was going to spend a summer, but in this funny chain of events, was given a little bit of a budget to explore opportunity in digital health, because it was the really early days. And it was funny. It was like, that was 2011. It was like right when like Fitbits were coming onto the scene, and like step trackers and wearables world. And then I'd be with my like tech friends from Google, and they're like, this is going to change healthcare. And then I'd be with my medical school classmates, and they're like, that's cute, Silicon Valley, like, get ready to get burned again. So where is the evidence? What disease areas you're targeting? Like, you're like literally like, you don't know anything. So I was like, the worlds needed to hear each other better. So the operative question for Omada became, well, how might one build a more evidence-based digital health company where you kept the product and design and tech bar high, but you just found a way to earn the trust of a very risk-averse buying market?
Mm-hmm.
So that led to like the condition areas, because it's easy to kind of explain why these are really intractable clinical problems for the country, and there's cost benefit and and ways to use technology. So that was kind of the genesis.
So you're already at a Series E, raised over 400 million. Long journey. Everyone always looks at that last thing that was done and success overnight sort of deal that you see on TechCrunch happen all the time.
Yeah.
How did you sign up those first customers, right? You're saying like, how do we keep that design up there, but how can we gain the trust of these customers who are very conservative? So like, how did you go about doing that?
It's really hard, and it's like in healthcare especially, it's like an ultra risk averse buying market. So I think oftentimes tech entrepreneurs will come to me, be like, hey, I'm super interested in healthcare, like 20% of the GDP, like huge opportunity clearly. And the first thing I make sure is like, what is their purpose? Like, what's the why? Because if it's like, oh, untapped market and I could make a lot of money, that actually will not serve you or the business well, because it literally is the double black diamond of enterprise entrepreneurship. So that's a headwind, yet the tailwind is it's easier to find purpose, and the purpose allows you to kind of abstract yourself from the business and suffer more punches. You know what I mean? So it's like, we just kind of remembered those early visits with people with diabetes in their homes. We're like, I don't care. We'll just swing and keep swinging. And like, so you can find,
let's hope that we're right. Let's get this right.
Yeah, because it's at the end of the day, I mean, your comment, there is no, I mean, I'm battle hardened enough now to know that there is no such thing as an overnight success. It's like, it's just like gritting it out is usually like what's required, and just constantly listening to the market and constantly trying to like take a first principles approach to serving your customers. So the early days of getting customers, was a bit about that. This is probably true in any enterprise buying market, but you just need to find the people that are like open-minded to taking a career risk because they believe that like something needs to be done differently. I remember one of our first customers, which was HealthNet, this payer in California. It was a medical director that like just viewed it as an injustice that metabolic outcomes were so poor and everyone was just progressing from pre-diabetes to diabetes in the country. And thought that would actually be differentiating for HealthNet to take like a proactive stance here. But I remember this moment, like sitting with this person in a WeWork, we're like 5 people. And he's literally like, and he wanted to come visit us. I'm like, shoot, because I would have much rather visit him.
That's hilarious. Yeah.
So I'm like in a WeWork, and he's like, Sean, like, I just got to be honest. Look, like we're in a WeWork. You probably had to book time for this room. I can see your entire head count.
You have people knocking on the door that it's their time to use it. Yeah.
I can see your whole head count right there. Like and I'm like about to write you into like a 5-year contract with one of our biggest customers. Like what literally gives me any confidence you're even going to be here in 5 years? And, it's funny. I think what I said was like, look, we're backed by great investors that have plenty of dry powder to help preserve our mission here. But it's funny. What I wanted to say is like, if you sign this contract, like
we'll survive. Yeah.
We'll survive. Like you literally are in the driver's seat. So,
yeah.
And then like, they're like, well, so, how do you typically implement? And you're like,
I'll tell you after we do this one.
So it's this amazing dance. You're like, you come up with tactics and be like, look, we tend to think really flexibly at our stage. Like, would love examples of your best in class implementations that we could perhaps use as references.
I love this. Oh yeah. I love that you have to say like, well, it's personalized. Like not everyone has the same exact journey. So let's talk about your journey.
Yeah, exactly. Like I want, I found that implementation approaches need to be really specific to each organization and at more stage.
That's hilarious. How did you know which particular enterprise to start with Because for a lot of founders, right, it's like
Yeah.
getting started. I know that every level is difficult, right? Matter of fact, I have friends that did the B, the C, the D, and each level brings a whole new set of obstacles when it comes to product market fit, to scaling and all that stuff.
Yeah.
But just the beginning for many of us that are in this new venture that we have, we're there. How did you decide? So you got to find that evangelist within that enterprise.
Yeah.
Absolutely. How did you go about in terms of contacting? Was there certain segmenting that you did that you're like, only this particular enterprises make sense for us within the diabetes? Like, was diabetes your go-to? That was the subject that was brought up for them, for people that maybe have a multiple set of products that their software helps solve. Like, do you stick to one and that's what you try and approach with? How did you do it?
Yeah, I mean, back then we were really in like the pre-diabetes and like advanced weight management category. We hadn't expanded yet to other areas. So we tried. I was like trying to be all sophisticated, like let's segment the market and the customer type relative to obesity prevalence or like employee churn. And like to be honest, it's like I basically threw all that away because the person mattered so much. You know what I mean? It's like, and any customer matters. So it's like if the evangelist happens to be at an org which maybe has a slightly less of an obesity issue, they still have some issue. But if they're willing to buy, they're willing to buy. It was like, so it was I ended up being on this crusade, especially in a risk-averse buying market, to just find the folks where they just saw the problem. For us, it tended in what we do to be like clinical executives. And there's like, you take 100, there's 5 that are like, they like truly care about like this issue enough where they're willing to make the bet. Now, all will care in some capacity because it's diabetes is an enormous issue, but it's like you are taking a career risk if you bring in an early company. So you have to find that subset. And so the segmentation I found was washed away entirely because you really had to find that person, and that person could live in any organization. So it's just shots on goal. And like,
and I know that technology, is fast. This space, this industry moves really fast. The channels that work for you then, I'm curious to know what was that work for you at that time in terms of getting in front of these customers. Was it conferences, or was it that email marketing, or was it spending a ton on blogs and that content marketing? And does that resonate now? Obviously, the company's in a very different phase, but are those channels still working, and would love to learn about the channels that work for you now when it comes to customer acquisition.
Yeah, I mean, it was kind of a mix. It was, I mean, the early ones were like, it was like conferences. I tend to think the mini ones are better, and like the, like the regional ones versus like go to the national ones.
Right.
I even
Massive.
think it's true to this day. It's like like we get more success for like the regional Pacific Business Group on Health meetup that includes like some of the local benefits leaders than like the national conference board where there's 1,000 vendors. So like, wherever you're selling to, they'll tend to have that like national conference. They also might have like regional meetups. And then, it's funny, it's just a little bit of like serendipity too. Like we closed Stanford Hospital as a customer for their employees early on. And there was just an advisor that I was like, loved and was trying to secure as an advisor. And he liked it so much that he had a lot of credibility over there. Like I show up just to try to convince him to work with us as the advisor. He's like, oh, that's cool. Happy to advise. But he just brought me over to the benefits office and was like, hey, we need to deploy this for our employees, please.
Wow. I love that.
Now, at the end of the day, it was this person's decision. That was the beginning of like a 1.5 year long sales process, but it's like, that kind of opens the door. And then critically, what I found early on, especially in a risk-averse buying market, is I not once called ourselves a startup. Like we've been a digital health company from literally 3 people on, because it is the opposite of attractive to buy from a startup in enterprise healthcare, like the literal polar opposite of attractive. So the whole like, oh, it's cool to be a startup thing, I dial that down as much as possible. And then you have to, for me, this was particularly important because I was really green when I founded the business. It's kind of like I never hired anybody. I never met an investor.
Yeah.
So, and I didn't know how I didn't know how business worked or the business of healthcare. I could read a clinical trial. So it's like, I just recognized quickly that you almost had to over earn the credibility. So I just like, if other people were just looking at like the summary news article on what the FDA said relative to the mobile health guidelines, I'd read the actual 100-page PDF and like come out like running circles around the people that just read the summary view and just multiply that times like 50. And what happens is like in the ether, as you go about evangelizing the business, your answers and the way that you see the world just become somewhat more precise. And then you rise from like, oh, who's this person building an app, to like, wow, they seem to like really understand healthcare. So
I love that.
you have to
I
just
love
like
that.
just chew on the raw material.
You
And
organically become a thought leader. Yeah.
yeah, exactly.
Just consuming everything, you organically force yourself to become a thought leader.
And it's no, totally. And what you'll find is it's the lazy way to just like read the summaries. Like you get on the CMS website and like read the actual PDFs, and then it's and then like it's not that hard actually. It's funny. You just need to carve out like the 2 cups of coffee in 3 hours.
I'm gonna jump into the product marketing fit, but before in terms of, once you do find product market fit, what are some things that you can do about it? But before doing that, very interested in pricing model when you got started, and how did you figure out, it's great hearing the stories, like, right, like one of your first customers came from the advisor and it kind of like serendipitous sort of deal, but obviously you're testing so many different channels, having all these different conversations.
Yeah.
When it comes to pricing, did you nail it from the get-go, or was that something that, it was the standard and it's very straightforward in how you go about charging these companies, or did that evolve?
No, it evolved a bunch. In fact, it was probably my biggest mistake, like ever at Omada, was not putting as much thought into pricing as one should. Because you don't. I wasn't in touch with the like how a P&L manifests over the course of the business life to understand what a lever that is. Now we rectified it. It's like I ran like a big pricing project like 5 years ago that like tuned, optimized, like thought about how the packaging worked, like all of that. So
in the beginning, when you were doing the pricing, you weren't keeping in consideration the margins, like the profit margins or the gross margins or any of that.
We were trying to, but it's like, it's just we weren't doing it as a sophisticated way as one should. And then truth be told, you kind of don't know your cost structure.
Right. I was going to say, you're working on imaginary stuff.
I don't have a finance team. I was literally like, I was our bookkeeper. I don't, what I mean? Like, what's the end state for what are like, what I mean? So I think early on, 2 rules of thumb. One is do everything you can to optimize for the recurring nature, if you can, of pricing, such that you have as long of a tail as possible, if it's possible in your product category. So like, SaaS, obviously that's inherent. GoPro has to sell a new GoPro every year and, go from like, 7, 8, 9 black, like,
right.
So try it if you can, relative to how your product delivers value, err toward more longevity in revenue, and then price way higher than you think if you're selling an enterprise. Like you literally, if you're not getting like that reaction when a buyer sees your pricing, you're doing it wrong. Because you're not, what I found is a deal, like if you price at a level that surprises people relative to the cost, usually that just turns into negotiation on pricing, not like, kick you out of the room.
So better to err on a much higher number that then you negotiate, if that's the case, rather than a number that correct. They're like, oh, or might be a red flag for them, I'm guessing, right? If they see something that doesn't even add up with at all
Yeah.
to what they're talking
Or,
about, they might assume you don't know what the hell you're talking about.
well, they're probably going to, anything they see, they're going to probably be like, well, that's a high watermark.
Mm.
So you have to, and what I recognize is like what an enterprise procurement process was. Like you literally like it, and this is no fault of mine, it's just the way people buy things. And it's fair. I mean, like we did this with our procurement team. It's like you know, you're like the way a procurement leader in an enterprise company wins is they shave off like 10%, you know, 20%, like they like, you know, well, we might go with this partner versus this one. Like they try to get deals. So you have to, if you don't bake that in to like, you're
Right.
toast. You
Right.
literally, because they're going to get that regardless.
Right.
So you have to just understand that enterprise buying motion involves like essentially a list that's like way higher and everybody expects to pull it down. And I think I just didn't know because I never sold anything in my life. I mean, I didn't even know what a contract was. I like didn't know how that worked. So I'm just like, let's just show the price that we feel like would be reasonable.
What will be fair? That's funny. Well, let's jump into product market. So you signed up a number of customers. It's starting to snowball. It's growing. How do you realize, when was the moment that you said, I have product market fit? And like, what were indicators for that? And then also, what should founders ask themselves or make sure to avoid when they think they have found product market fit?
Yeah. So step one is like come to a like somewhat of a reasoned sense of what your sales cycles are. And let me just kind of elaborate on why that's the important first step. That will be, you will have a very different experience of product market fit depending on the length of your sales cycles. So, you know, in consumer, you almost can get it instantly. It's like literally as long as you like get what you have in front of people, you're like, wow, people seem to really want this.
Right.
In like a SMB play in enterprise, let's say it's like you think you can sell these deals in 3-4 months, you'll start to like see the pipeline fill, you'll start to feel it to manifest. If you're in our world where it's literally sales cycles, you just love it or hate it, they're like 1.5 years, 2 years, you may have it and no points will show up. And so it's like in that world, you can get a lot of skepticism internally from your team. Do we have product market fit? Like, is this working? Like, nobody seems to be buying this. If you don't have like investors that are experienced with long sales cycles, they won't know to look at the proxy measures. Like they'll like, you know, 3/4 in, they'll be clearly we have the wrong strategy here.
Right.
So
I was just gonna say, how many then with that sales cycle is so long? What do you give yourself in terms of time to look back? Right? Are you saying like, let's look back at the last 4 years and engage from there? You know, like how do you how
yeah,
can you put forward that long-term view and make it something that's apparent?
I mean, you can try to look at like proxy measures of like, you know, are people willing to book like even meetings with us? Like that's kind of a semblance of product market fit, and you know, in like some sales process measures. But it's really unfortunately, until you actually land the deals and they manifest into revenues, you're not going to have points on the scoreboard. And it's like any proxy measure will be viewed with critique. So you know, it is a funny, vexing challenge to manage through that. You know, I think the most important thing is expectation setting, where it's like, here's how we're going to know whether or not we're on track for something versus not. And that's both at the team level, but also at the board and investor level.
Right.
And it's like, firstly, you know, are we in a space that matters? The signal for that is going to be, can we even get the meetings? So we got to study that and monitor it. And like, you know, will the consultants meet with us? Do they agree that we're in a space that matters? You know, secondly, do we have something that serves the needs here? Like, does one meeting turn into the next? Like, we're going to quantify our sales process and pipeline here. You know, thirdly, like, how do the metric, like, can we get people even into solutioning and contracting? And you know, but because of our sales cycles, you know, I'm just going to paint a vision where we could be in a meeting 4 quarters from now, not see this manifest financially, have perfect product market fit, and we're all going to question that. So we got to remember the conversation right now at that moment in time, and remember that here's the things we need to look for to either feel centered that we're on the right track, or the warning signs that we may be off.
I love that. Let's jump into scaling and some of those challenges. So on LinkedIn, you mentioned that Omada had recently crossed 1 million members. Congratulations. But you said to create real impact, you aim to get tens of millions, right? So how do you plan to scale now that you're at that 1 million member mark? How do you plan to scale, 10x? Any advice that you've come across from other founders that now get you to that next category of growth?
Well, yeah, I mean, I guess I kind of I don't know what'll be in store.
It sounds great. Gets everyone excited. Right.
Yeah. I mean, the good thing is there's you build an engine at, even at the mark that we're at, you've had to refine some of the critical things. So, in an ideal world, to go from 1 million to 10 is less of a leap than go from 1,000 to 1 million. You know what I mean? But we'll find out. I mean, I think the TAM is there in our space. And then we've got we've built and developed a lot of organizational capabilities to, I think, at scale, execute against that TAM. So it'll be very challenging. It'll be very hard, but I think that hopefully it's a little bit we've got enough modularity in what we do that we can just continue to stay ambitious.
When did it make sense for you? This is in line with growth, and you mentioned about advisors that you, even from the beginning, that you were thinking of bringing on board. When did it make sense for you? Maybe thinking of it as advice for founders now, but where does it make sense to have that board or have those expert advisors be part of your journey?
I mean, I think a board can make sense at either if you raise a larger seed or at the A. I mean, one could structure it such that if you do want to take on a board seat at the seed, it's look, let's just have the seat by automatic roll off at the A, but let's, and then we can have a conversation on it still makes sense based on, the pro forma ownership and the business needs. It kind of depends. The early stage, you take on risk and opportunity in creating a board. The most important thing I found is the person precisely aligned with the vision for the company. You know what I mean? Because if you get strategic drift early on, you get into tensions at the level of the board relative to where you want to take the business. Do you want to pivot to consumer if the enterprise side takes too long, or shouldn't we be doing this, or trying that? So we're blessed in that our early investors carried a lot of strategic alignment with me and my co-founders on where we wanted to take this. And then you didn't shy away from investing in a clinical trial that was going to take 3 years and cost, $1 million. Because you recognize that it was important. What a board does do for you is it kind of forces that regular quarterly inspection of where are you doing? You know what I mean? The best boards, you're in the trenches. Your to-do list is infinitely long. It'll never get shorter. And so the best boards kind of, for that moment, pull you up out of the gopher hole, force you to look around a little bit and throw you right back in. So yeah. That I think is useful. I think in large part, advisors don't have a lot of utility. Or rather they're, maybe I'm saying that wrong, or their utility is specific and fleeting. Where it's you may need this specific advice in this certain area and find someone that can provide it. And if you're doing your job right, you'll have asked more questions than a 3-year-old to understand how what they know can impact your business. And then you find you're just you kind of tapped out on how the utility is. Yep. So when I get asked to be an advisor, I'm I'll just help you. Don't worry about
just give me the question you have in mind and I'm happy to answer.
Yeah. So it's not, I don't know and I mean, I've never found that investors were like, oh my gosh, this company has like the world-class list of advisors. So you want to, and most of the utility has come
Yeah.
from like the other CEOs in my space and like, just like, the community.
I love that. I love that. Same, likewise. And I feel like this is why this exists, right? These groups for us to be able
Yeah.
to learn from one another's mistakes, and this is priceless. You mentioned about the Series A, and you're talking about like for board members. In terms of fundraising, so you've raised over 450 million, some number, some very large number, right? What advice would you give your younger self if it when it comes back to fundraising, and what are things that founders should keep in mind as they're going through this journey also?
Yeah. So I mean, step one is like make sure you're like centered with the purpose of fundraising. And I felt like I always kind of was. Like it's like I never like actually felt like any sense of like exuberance or celebration in like raising money. It's like I honestly, if I could bootstrap Omada and still get the scale like that we've got and have the impact we've got, like that'd be the best route. But it's not possible. Like you need venture to like bust through.
Bring in
Um,
the most talented people you know.
that's
Yeah.
right. And like, and just, make sure that you can, be there to get a couple sales cycles under your belt. Like you have to be able to fund the headcount to do
Mhm.
that. So you need venture, especially in our space. And so that's kind of like a good, helpful orientation. Like if you feel yourself thinking more about like, oh my gosh, how fun will it be to raise that round versus like, am I really solving my customers' problems? Like your brain is tricking you on like real value. Um, in terms of the actual fundraising process and tactics, the best thing possible is to work to really empathize and sit in the seat of an investor. And like, if you have friends that are GPs, like, buy them coffee, multiple coffees, and like help to get a sense for what the world's like. Like what are their accountabilities? Who are their bosses? What are their LPs like? When they have to report to their LPs, what are the things that the LPs care about? What is their fund cycle? How does a fund work? When you love a deal, how do you socialize it? What is like, you know what I mean? Like it's, and once you have a sense for, okay, I'm living in their life, that will massively accelerate your ability to raise money because you just have empathy for what they're doing in their craft. And
I
that
love
will
it.
allow you to like, not get duped by like, oh my gosh, I got this like second meeting with Sequoia. Here comes a term sheet.
Right.
Right, which like early founders always do. When, if you get invited to a Monday morning partner meeting, maybe you got a 50-50 chance of getting a term sheet because like any voice can be terminable to a deal. So,
Right.
it's just literally it's empathy for the craft of investing. Like that's the number one.
I love how you phrase it, the empathy, because I think about it as just incentives as well. Like, what are
Yeah.
they incentivized for? But
Mhm.
yours sounds way better. I like when you say empathy versus incentives, but it's true, because it's all tied. It's all tied to what they're
Yeah.
hoping for and what they're looking for. It makes a ton of sense. So
And
I'm gonna.
recognizing that like, last thing on this, and recognizing that, finding an attractive outcome for the business is not mutually exclusive with treating them and their craft with a lot of respect, because it's like, I think that weeds out folks that you wouldn't want to work with anyway. And it is a very big deal to lead a deal as a GP. It's the least, venture is not scalable. You literally, as a general partner, you can maybe take on like 8-9 boards, and then you're like at max.
Right.
And your entire career is like dependent on those being successful.
Yep.
So it's like I've seen founders make missteps fundraising, like, treating the GPs poorly.
Hmm.
I've seen GPs make missteps in attracting quality deals by treating the entrepreneurs poorly. So it's
Hmm.
like, and make sure to recognize that there's no like, both sides need to, it's not a negotiation in venture investing and with a VC. It's not like a zero sum thing. You can find a world where you're serving the company's best interest and you're getting a good partner that feels respected, even if they're like, dang, I had to pay a lot for this deal.
Yep. Thank you, Sean, so much for your time. All the
Okay,
best.
all right, bye.